Hello and welcome to St George's University of London's webinar on biomedical sciences and clinical pharmacology. My name is Jenny. I'm a student recruitment officer at St George's. And with me today are two panelists, Dr. Kate Everett and Professor Emma Baker. Dr. Everett and Professor Baker, would you like to introduce yourself to our guests?
Hello, I'm Emma Baker. I'm the course director for the BSc in Clinical Pharmacology. Looking forward to speaking to you about the course.
And my name's Dr. Kate Everett, and I'm a reader in human genetics, and I'm one of the academic admissions tutors for biomedical science.
Thank you both so much. And also with us today is my co-host Fiona. And Fiona is going to be going through your questions and then will join us at the end of the webinar where hopefully our two panelists will be able to answer your questions. So do keep them coming in. So I'm going to start by giving you a brief overview of St George's, the university, and I'll also talk to you a little bit, and Dr. Everett will discuss the Biomedical Sciences course program with you, and then Professor Emma Baker will discuss our Clinical Pharmacology program. And then at the end, we'll have some time to go through your questions. Now, first, let's start with taking a look at what St George's has to offer. We're going to look at the brief history of the university, where we're located, and also look at some of the students and our facilities. Now, I'd like to first start with looking at St George's and going back to where we began. And St George's is the only UK university that shares its campus with that hospital, St George's Hospital, which you can see a picture here of when we were located in central London. And this close relationship between the university and the hospital has been going on for more than 250 years. And St George's opened in 1733 near Hyde Park Corner in central London. And you can see the picture here of the hospital and the entrance with the ambulance. And although we began as a medical hospital and medical courses, we've since then, with our first doctors graduating in 1752, we've now developed a whole range of undergraduate and healthcare courses, which we'll discuss two of them here today. And we're very proud of our alumni, and I want to talk to you a little bit about some of our most notable alumni. We've got John Hunter, who's often referred to as the father of modern surgery, and he studied and worked at St George's Hospital, and many of his specimens can be found in the Hunterian Museum in central London. Edward Jenner was a pioneer of the smallpox vaccination, which has since been eradicated. Smallpox has been. And this pioneering research continues at the university within our Infection and Immunity Institute. And some of our researchers are currently involved in the COVID-19 vaccination trials and development of antibody tests. So if you're interested in that, then please do go onto our website and you can find out some more information. We've also got Henry Gray. Now, he's also a renowned surgeon, and he's most notably known for his anatomy book that he wrote called Gray's Anatomy, not to be confused with the television program. And he wrote that alongside Henry Van Dyke Carter, who did the illustrations for the book. And Gray's Anatomy books are still in production and a really useful resource for anyone who is studying anatomy. We've also got a Professor Frank Chinagwindu, and he's a consultant urological surgeon, and he specializes in cancer care and raising awareness about prostate cancer symptoms. And he was awarded an MBE for his services to the NHS. We've also got Professor Dame Nancy Rothwell, the first woman president and vice chancellor of the University of Manchester, and her research in the field of neuroscience has contributed towards the understanding and treatment of brain damage due to stroke and head injury. And we've also have Professor Helen Stokes-Lampard, who was the chair of the Royal College of General Practitioners. She completed her medical training at St George's, and Professor Stokes-Lampard is due to take up her new role as chair of the Academy of Medical Royal Colleges in July of this year. Here we have some of our more recent alumni, and if you'd like to know more about their achievements, please do go onto our website. You can see the details here and you can learn more about their achievements. In the 1980s, St George's, the hospital and the university moved to our current site, which is in Tooting, southwest London. And at St George's, our students really have access to being surrounded by healthcare. You might be familiar with St George's Hospital if you've ever watched 24 Hours in A&E, which is the Channel 4 program that's filmed at St George's Hospital. And here you can see on this slide our helipad for the hospital, where our air ambulance bring in patients requiring critical care. At St George's, we're located, as I said, in southwest London, in Tooting, and this is a really vibrant community where we've got Tooting Broadway High Street, we've got the Northern Line station, which is about a 10-minute walk from the university, which means that our students can get into central London in about 25 minutes, and we're surrounded by a really vibrant community of shops, retail shops and bars, restaurants, our markets. So it's a really enjoyable place to study and as well as live. We also have a really active student union, and we have over 100 clubs and societies, and you can see some of them shown here. We don't run classes on a Wednesday afternoon so that our students can participate in activities. We also have a student life centre which provides guidance and support to students and can provide access to either career support or welfare support. We also have facilities such as prayer rooms and counselling facilities, and we have an extensive library. We have lecture theatres and study areas. We also are really proud of our pathology museum with over 2,000 specimens. We have an in-house dissection room, and we also have facilities for simulation suites. So if you're interested in learning a bit more about this, please do go onto our website. There's lots of information there. And you can go to our Explore St George's webpage, where you can look at webinars we've done previously where we do discuss some of this in a bit more detail. And also we have here, I want to just talk about our St George's courses. We're going to be discussing these courses, or specifically we're going to be looking at these two courses today, the Biomedical Sciences and the Clinical Pharmacology. But here you can see some of the other programs that for those of you who are interested in medicine, we've run a webinar specifically on medicine, so you can go and have a look at that or our healthcare courses on our Explore St George's webpage. So now I'd like to introduce our first panelist, Dr. Everett, who will then discuss our undergraduate biomedical science program.
Thank you very much, Jenny. So hello and welcome to this webinar about the Biomedical Science undergraduate degree at St George's University of London. Thank you for taking the time to register and to attend today. So I'm going to provide you with an overview of the Biomedical Science course, then give you a little bit more detail about some of the key features of the programme and what makes it differ from other biomedical science programmes, before finishing with some information about what our graduates tend to go on to do after they complete their biomedical science degree. Next slide, please. So the biomedical science degree provides you with a broad understanding of the scientific basis of human health and disease, including study, investigation, diagnosis, and treatment. Our modules in the first 3 semesters cover molecular and cell biology, physiology, pharmacology, anatomy, and genomics. In semester 4, which is the second half of year 2, all of this knowledge will be brought together to apply to the clinical pathologies. So by this, I mean clinical immunology, clinical hematology, clinical genetics, and so forth. These first 2 years provide you with the general expertise to then specialise in the final year in a particular pathway, which I'll give you a little bit more information about in a moment. There is also the option to transfer to a 4-year MSci at the end of year 2, as long as you have an average of at least 60% in your exams so far. This is a really exciting opportunity to get a postgraduate level qualification without needing to apply separately for a postgraduate course. You can in fact apply for this through UCAS rather than applying for the BSc if you wish, but you can move between the two once you're here. So you can move between the BSc to the MSci, and you can move from the MSci to the BSc if you wish. So the MSci really is designed for those of you who are thinking of doing a PhD after your degree or moving into research generally. This is the only MSci in biomedical science in London, and it qualifies for 4 years of undergraduate funding because technically it is an undergraduate degree, which is why you can apply to it through UCAS. So MSci students follow a pathway in the same way as BSc students in year 3, as well as doing some additional taught modules, especially to prepare them for higher level research. And then in their 4th year of the course, MSci students spend the majority of their year doing a large-scale postgraduate quality project, which is a really exciting opportunity. Next slide, please. So I've mentioned several times the pathways which you can specialise in during the final year of the BSc or the 3rd year of the MSci. And this slide here shows you the current options. So currently our students can specialise in either anatomy, cell and molecular biology, genomics, global health, infection and immunity, medical ethics and law, physiology and pharmacology, and psychology, psychiatry, and neuroscience. So each pathway has particular specialized taught modules associated with it. So for example, students on the genomics pathway do 3 taught modules: human medical genetics, clinical application of genomics in cancer and rare disease, and personalized medicine. Students will then graduate with a degree in biomedical science with genomics. So this pathway allows you to stand out when applying for jobs or future courses, indicating that you have a particular expertise in an area of biomedical science. We also have a clinical bioscience pathway in the final year, which is specially designed for students wishing to go on to do medicine after the Biomedical Science BSc, and I'll return to this later. Next slide, please. So teaching across all years takes various forms. So there'll be perhaps what you'd expect in terms of large lectures, but also small group teaching, problem-based learning, large lab sessions, and dissection of cadavers as part of anatomy. In the final year, you also do research projects, which allows you to work with research active academics in their labs or doing clinical audits and get a taste of real-world research. Our physical position on the same site as St George's Hospital allows vital collaboration between clinical staff and the university, which benefits our research but also enhances our teaching as our clinical colleagues contribute to the education of all our students. I also want to flag up that careers advice and development of transferable skills is built into all years of the degree to prepare you as best as possible for life after your degree. Another option you have, which is an excellent way of developing your skills, knowledge, and your professional network, which is so vital, is to do the professional training year. So the professional training year allows you to gain experience in the world of work in an area that is relevant to your degree. Paid placements are available at a range of different work environments, including Great Ormond Street Hospital, Pfizer, Glaxo Wellcome, and Public Health England. These are really exciting. Evidence also indicates that university students who do a professional training year do better in their degree and ultimately earn more than their peers who did not do a professional training year. So that's worth really thinking about. And at the very least, it looks fantastic on your CV and will provide you with quality references from the people who you work for. So I've already mentioned the clinical bioscience pathway, which is a specialist final year option for students wishing to go on to do medicine. Now you need to be getting at least 66%, so that's 66% in your exams in the first 2 years to be eligible to apply for this pathway. And if you go on to do this pathway, it includes specific clinical modules which will prepare you for studying medicine, such as communication skills. If you do this pathway, you will actually graduate with a BSc in clinical bioscience rather than biomedical science. But again, this emphasizes your real expertise. So a unique feature of studying biomedical science at St George's is the opportunity to apply for the clinical transfer, which is indicated on this slide. So this actually allows you to enter into year 2 of our 4-year graduate medicine degree after completion of your BSc. So if you wish to apply for this clinical transfer, you need to follow the clinical bioscience pathway. You will be interviewed using multiple mini interviews at the end of year 2. And if you are successful in these, you'll be made what's called a conditional offer. And this conditional offer would be getting a 2-1 in your clinical bioscience BSc. That's at least 60% in your degree. Now, a bonus to this is that you don't need to sit a UK CAT for the clinical transfer. And as I say, a lot of our students have seen that as a real bonus, so they don't have to do that. Next slide, please. Our biomedical science graduates go on to do a huge range of careers. A significant proportion of them go on to further study, and I've already mentioned that some go on to medicine, either here at St George's or elsewhere. Some even go on to dentistry as well. But others will go on to do MScs in many, many different subjects. So recent students of mine have gone on to do MScs in neuroscience, infectious disease, genomic medicine, and global health policy. So it's really quite a range. We also have graduates who decide to convert to law and use their analytical skills that they have developed during the course. Others have gone on to get places on PhDs, and many of these students then go on to work in academic research themselves or forge careers in industry, researching fundamentals of disease processes, for example, or developing new therapies or diagnostic tests, whatever it is. The degree also prepares our students for vital work in the NHS, perhaps as a biomedical scientist or as a clinical scientist via the competitive NHS Scientist Training Programme. Perhaps ever more vital at the moment. So biomedical science really does provide you with the knowledge for a wide range of scientific careers, but also gives you the transferable skills in communication and analysis for a career outside of the scientific arena. I hope that brief webinar gives you greater understanding of what we offer here at St George's on this exciting biomedical science degree, and I'll be happy to take questions later on in this. Thank you very much for your time.
Thank you, Kate. Thank you so much. And now I'm just going to talk a little bit about the entry requirements. So let me while I get the screen up. So, and Kate will stay on and she'll help with the entry requirement side of it. So first of all, the first thing to think about is to make sure that you make your UCAS application on time. It's the 15th of January is the deadline for the Biomedical Sciences program. You'll also need to add your the UCAS student code, institution code, sorry, and the course code, which are listed there when making your application. You'll also need to make sure that you meet the entry requirements for the programs. So do make sure that you look at the GCSEs and also the other entry requirements. If you're doing A-levels, we'd be looking at 3 A-levels, including, so grades A, B, B, including biology and chemistry. And for your GCSEs, you'll need to hit 5 of your GCSEs will need to be a minimum of grade 6 or a B, including English language, maths, and biology and chemistry. If you're not doing A-levels or doing a different course, please go onto our website. Details are there and you can have a look at the other courses that we consider. And then lastly, we want to look at the personal statement. And in the personal statement is really about you communicating to us your interest in the course and your passion for it and how you're best suited for the program. And hopefully Dr. Everett will be able to advise you a little bit more about what we're looking for in the personal statement.
Yes, thank you, Jenny. So really, I mean, you've said it there. We're looking for real passion about science in there and what it really means to you. And perhaps if you've got any thoughts about what you want to go on to do afterwards. But I should also say, I mean, often people worry about being able to demonstrate that they've got work experience in a personal statement. And I want to say that we understand that it's very difficult, if not impossible, particularly at the moment, to actually get scientific work experience. So that will not be negative in your application. If you can demonstrate any other sort of experience you might have had in life where you've just had to use analytical skills or demonstrate initiative, these are always good things to have in there. But just showing some sort of love and passion and enthusiasm for the subject is really what we're looking for at the moment. And if I may also say that something else that crops up that people worry about is that we, understandably, we get students applying for biomedical science who are also applying for medicine, and they have to mention that in their personal statement as well. And I want to reassure people that that's not a problem, because if you're interested in doing medicine, then by default you're also interested in biomedical sciences, or you should be. So a good personal statement for medicine will also be a good personal statement for biomedical science. So that would be sort of my key take-home message from those.
Great, excellent advice. Thank you so much, Kate. Yes, just to reiterate, we've got some information on our website regarding work experience. If you go to the Explore St. George's webpage, and there we've given guidance for a range of our programs regarding work experience. So do take advantage of that. And next I want to, and thank you, Dr. Everett, for your time. And now I'd like to introduce Professor Baker, who will now talk about the clinical pharmacology program.
Thanks very much, Jenny. And thanks, Kate, for a really great sort of view of what studying science is like at St. George's. As I said at the beginning, my name's Emma Baker, and I'm the course director for St. George's for this degree. And this is the UK's first BSc in clinical pharmacology. I'm going to give you a brief overview, including explaining what clinical pharmacology is. I'm going to tell you what you will study and how you'll study it if you come and do this degree, and also explain the myriad of fantastic opportunities that this degree could open up to you for your future. Next slide, please. So clinical pharmacology is the study of all aspects of drugs as they relate to humans. I'd like you to think back to the last time you took a medicine, a pill or a tablet, such as a headache pill or an allergy pill, or maybe an inhaler for asthma. Have you ever wondered where that came from? Well, someone had to have the idea that that was something that should be treated with a drug. They had to find the target by understanding the science of the body and the disease. They had to then find a chemical molecule or other type of molecule that would hit that target, and that's called drug discovery. Then, the next thing you have to do is put that drug into a person for the very first time. Can you imagine how exciting but also how scary that is? Hoping that the drug will be okay, that they won't have any side effects, so you'll be able to go on and develop it as a medicine. Once you get past that hurdle, the next step is a series of experiments called clinical trials, and all the way through to something called a license. And then the drug is available for the use in the NHS or for healthcare to treat patients and the diseases. Then we have doctors maybe prescribing the drug or other healthcare professionals, pharmacists dispensing the drug, we have nurses maybe administering the drug. All of that, all the way through from finding that molecule, understanding the science, understanding how it works, all the way through to treating diseases is clinical pharmacology. It's never been more important than it is now. All of the work you'll have been hearing about with COVID, people trying to develop new medicines, new vaccines to manage COVID, that is all clinical pharmacology. So a great time to be dialing into this webinar. The clinical pharmacology degree at St. George's, as you can see, is a 3-year program leading to a BSc honours. Honours means that it's a research project. There's a research project in the degree, and in fact, there are several projects in this degree. It's really important to say at this point that it's been designed, this degree, it's a new degree, and it's been designed in collaboration with employers. The aim of our degree is to create graduates that are ready for work or further study in drug development or research or some aspect, for example, healthcare. And if we want our graduates to be work ready, we need to know what employers want. And they've had some input into the degree, as I'll show you later on. And our students all do work experience, a 6-week placement in year 2, in industry, for example, in a big pharma or in a contract research organisation to see drug development at the coalface. They also all do research projects, and there's an option for a professional year, as Kate's explained, between years 2 and 3. Next slide, please. So what would you study if you study clinical pharmacology? This slide shows the big 6, our 6 modules, and you'll study these modules throughout the course. You do the introduction in year 1, you get a bit more detail in year 2, and you go to an advanced level in year 3. So a spiral curriculum, if you like. Working through them, on the left you can see the human cell exemplifying the science that you need to know to understand pharmacology. So you need to know how cells work, how the body works, some genetics, you need to know some physiology, you need to know some pathology, which is the disease. So you need to know all of that. But we don't just teach it in our course in a block at the beginning, we teach it as you need to know it. So you can then apply your knowledge to the pharmacology and to the drug development, etc., and so gain a broader understanding. The top 2 boxes are the pharmacology. So pharmacodynamics means how drugs work. And what you can see in the picture is the yellow blobs is a drug called a statin, which you've probably heard about in GCSEs in A-levels, which lower cholesterol. And here you can see that it's sitting, if you like, holding apart an enzyme, stopping that enzyme, which is called HMG-CoA reductase, from acting to synthesize cholesterol. And in this module, you learn all sorts of exciting things about drugs past, present, and future, and how they work. For a drug to work, it's got to get to where you need it. So if you've got a headache, you need that medicine in your head. And the movement of drugs around the body is called pharmacokinetics. The little green man in the picture you can see is swallowing a capsule, and that drug will be absorbed into the bloodstream, distributed around the body, and then at the same time, the liver will be breaking the drug down and the kidneys will be excreting it. And this careful balance of these processes, pharmacokinetics, is required to get the drug to the right place in the right dose at the right time. The bottom 2 modules I've touched on briefly in my introduction are drug development and drugs in healthcare. This degree is really applied, and you'll see in a minute how hands-on it is. But you won't just be learning the theory, you'll actually be learning how pharmacology is applied, all the steps about drug development and how it's used in healthcare. And you'll meet patients, doctors, pharmacists, go on hospital visits, etc. So you can really get the big picture. The module on the right, data and statistics, is an important part of this course and might feel a bit scary for those of you who are not that keen on maths. But if you can imagine that drug development is a whole series of experiments collecting information, that's the data. And as you collect the data, you need to be able to look at it, manage it, handle it, interpret it, analyze it, and make decisions. And that's what data and statistics is about. And everyone who comes out of this degree will understand data, even if they're not a big statistics fan and they don't like maths. Next slide, please. One of the things our students love about the course is that it's very hands-on. And so about a third of the course is lectures, but a lot of the course is doing stuff. From the top to the bottom and from left to right, you can see that our students do practical skills every week, either clinical trials or laboratory skills. And the data that they generate from those practicals goes into the data management sessions that they have where they analyze their own data, their class data, etc., and learn how to do data handling and statistics. In the clinical trials, for example, our students in their first month of first year have already done a session called How to Tell If Someone's Alive, measuring pulse and blood pressure and respiratory rate and oxygen, that kind of thing. And they go on to do some little clinical trials. They do blood taking, drug administration. You'll be glad to know that's on a dummy to start with, and then things like basic life support. So a good foundation, for example, if you did want to think about going on to graduate entry healthcare. But the reason we learn that in our course is because some of our graduates will go and work in clinical trials units where they are part of the team, seeing patients that are taking new medicines. At the bottom, you can see that work-ready skills are also all about being able to communicate, give presentations, work in teams. At the bottom left is one of our first year students at the end of semester 1, standing up in front of an audience of over 70 people, including our principal and some visitors from Big Pharma, giving a presentation in a Dragon's Den event. And all our students come in scared. They can maybe just talk about a drug for a minute in their first small group session, and through the course we get them to do a lot more and more each week, presentation skills, courses, so that already by the end of year 1 all our students are competent presenters, and by the end of the course they'll all be stars. Teamwork, you can see a gang of students here who are presenting a poster that they've made of data analysis, and our course is quite small, which is a great feature of it. At the moment we have between 50 and 60 students in a year, and so it's a very close-knit cohort, which is really important. And you can see that all of this information is being collected in a skills portfolio. So at the end of the course, you have something to show employers about what you can actually do, not just about what you know. Next slide, please. I've said already that our course is really hands-on, and we have lots of different ways of teaching and learning. About a third of the course is lectures, and you can see at the top left here our gorgeous new Curve Lecture Theatre, which we opened this year. It's a really nice place to have lectures. And we encourage our students to be nosy and curious and to ask questions, so they're not just sitting there as passive recipients, they're participating. At the top right, you can see small group teaching sessions, and we have 2 of those a week. At the beginning of the week, you have something called the Hub, where students practice all their skills, presentation, analysis, critical appraisal, and they also have the same tutor every week. And that tutor is their personal tutor who can then go on to support them through the course. At the end of the week, you're in a different tutorial group, so you get to work with everybody on the course in some way or another, and that's called drug-based learning. And here we look back at the previous week's learning and apply that in a real-world scenario, like an experiment or a patient or a clinical trial. The other pictures at the bottom left shows our students doing a workshop. Here they're doing a clinical trial or working in the lab. And I think at this point I'd like to emphasize again the small cohort and a very supportive course team. So there's lots of support for you making that transition from school to university. You'll see the same people. We know everybody's names. We're interested in how they get on, so someone will be looking out for you. Every student does work experience. I think I mentioned that, and it's another opportunity for me to say how the employers are contributing. So we have employers from a whole range of different types of sector offering work experience for our students, mentorship. There's an option to take time out to do a professional paid year between years 2 and 3. And as the course goes on and the students know more, we have more and more visiting lecturers coming in, bringing their expertise. And industry is really excited about this course because it's perceived that there is a skills gap in clinical pharmacology in the UK. There are lots of jobs and there are lots of people who want this course to succeed. And so we have a lot of support. Next slide. You must be worried thinking about coming to university at this time when we still don't know what's going to happen with lockdown. Are you going to be on site? Again, with challenges, there come great opportunities. At St George's, we have a great learning management system. We use Canvas. Some of you may know that from school. And this COVID experience has meant that we've all got to get much better at learning and teaching online. So we've already converted quite a lot of our course into interactive online learning. We have active live face-to-face small group teaching. We have workshops online, lots of worksheets, interactive things to do, quizzes, etc. And our students have all, although been sad not to be on site for this year, felt that the learning materials still make the learning interesting and exciting. And going forward, we will still have our practical sessions on campus. You can see this slide just shows a little front page of our Canvas page with some enticing looking modules, hopefully. Next slide, please. In my tutor group, I asked my students at the beginning of the year what they might like to do, and a lot of them thought maybe graduate entry medicine. And when I asked them again, about 2/3 of the way through first year, I asked them again and I said, "Are you lot all want to do graduate entry medicine?" And they said, well, it was maybe at the beginning, and now it's even more maybe, because they had so enjoyed the course at that point and so continue to do so, and also seen how many opportunities this opened up. There were many possible careers, not just medicine. So with this degree, you could go on straight into a job. You'll be ready to go and work in clinical trials or maybe in a lab. You could work with data. You could do, depend what sort of person you are and what you like. You could also go on to do a master's or a PhD. You could end up in industry or in a university, that's academia. There are entry-level jobs at healthcare, for example, technical or managerial, that you could do with this degree, or you could go on to graduate entry healthcare, and you could work for regulators such as the National Institute of Health and Care Excellence, you may have heard of, doing critical appraisal, looking at the literature, working out what we should do to treat people the most effective way. There's a whole myriad of careers opportunities, and as I mentioned at the beginning, industry is very excited about this degree because they see this as a skills gap that needs to be filled, so there are jobs. Who knows, you could be the next person researching new drugs for COVID or for the next pandemic. I think that's my slides finished, Jenny. Sorry, last slide. Just if you want to find out more, visit our website, chat to our students. Here's Pfizer on Unibuddy. Have a look at some of our social media sites, particularly Clinical Pharm on Instagram, which is a blog of one of our first year students about her experience studying clinical pharmacology on our BSc. And I've put my email address, ebaker@sgul.ac.uk, and I'd be delighted to hear from any of you at any time if you have any questions. Thanks very much, and back to Jen.
Thank you, Professor Baker. That's really interesting presentation. So I just wanted to finish off by talking a little bit about the entry requirements. For clinical pharmacology, it's really important to apply by the 15th of January deadline. The institution and course codes are on your screen here, so take a note of them. And the next part that's really required is to make sure that you meet the entry requirements. So if you're doing A-levels, we'd be looking for grades A, B, B, including biology or chemistry. And for the GCSEs, we want you to make sure that you achieve a minimum 6 or a grade B in the maths, English language, and the sciences. And if you're not doing A-levels or you're doing a combination of different courses, do go onto our website. The details are there, and you can see some of the other courses qualifications that we accept. And then lastly, I want to talk a bit again about the personal statement. Like I said before, with the Biomed course, it's really important to do your personal statement, showing your interest and your passion for clinical pharmacology, and showing what you know about the course. So maybe Professor Baker might want to talk a little bit about what you're looking for specifically with an applicant.
Thanks, Jenny. So I would say 3 words to you, which is our strapline of our course is motivated by curiosity. We would like students who are open-minded, interested, and want to learn. As Kate said, we don't expect you to have relevant work experience. We don't mind if we're your insurance offer and you're applying to medicine and your statement is based around medicine. But what I would like to see in a personal statement is someone who, as Kate said, is passionate, is interested in all things healthcare, medicines, but particularly perhaps that if you're interested in research and you're curious and nosy and you want to know things, that's the students we would love to see. So, and write your personal statements yourselves. Maybe get someone to look at it and tidy it up, but write it from your heart, because that we can see that, and then we know that we want you, and we want enthusiastic, passionate people. Thank you.
Great, thank you so much. That's wonderful. So I want to. That's the end of our presentation, I want to thank both of our panelists who are going to stay, and hopefully, Fiona, do we have some questions from our audience that Professor Baker and Dr. Everett could answer?
Sure. So hi everybody, I'm Fiona. I'm just going to ask some questions. So thank you. We have had lots of questions. If we don't get to answer yours today, we will get back to you after the event with the response. So Emma, we've had two people, Alyssa and Emma, ask, what's the difference between pharmacy and clinical pharmacology?
Hi, Alyssa and Emma. That's a really good question. I sound like a politician, don't I? Pharmacy and clinical pharmacology are related in that they're both about drugs. Pharmacy is a healthcare profession and clinical pharmacology is science. So if you imagine, do you want to do science or do you want to do healthcare? Science would be like biomedical science, clinical pharmacology. You will study science, you will study theory, you will do lab experiments, you'll learn about research and methods and critical appraisal. If you want to do healthcare, you might become a pharmacist or a nurse or a doctor. You will learn some of the science, but you'll also learn much more clinical application of that and practice. So you will, by the time you graduate from a pharmacy degree, you will be someone who's working maybe in a pharmacy in the high street or in the hospital dispensing medicines to patients. If you do clinical pharmacology, at the end of the degree, you might be developing medicines in a clinical trials unit or studying further to become a research scientist developing medicines. I hope that answers your questions, but if you'd like to know more, email me or reply with a follow-up question.
Great, thanks a lot, Emma. So Kate, we've had a couple of questions about the professional training year. We've had Georgina ask, is the professional training year funded by student finance? Not sure if you know that one. I can check if not.
No. So essentially what happens in the professional training year, and again, I can provide details of our expert on this, who is one of my colleagues, but really the purpose of the professional training year is that you will be earning during that time. So the different placements or jobs, which essentially they are, they vary in terms of how much you'll be paid. But if you imagine if you get one of the positions at somewhere like Glaxo Wellcome, that can be earning up to about £23,000 in the year. So it's pretty good. So you'll be earning in that way. So that's where your income is coming from in that year. Does that help?
Yep, that's great, thanks. We've also had a question, is all the professional training set in that year, is it in the UK? That's from Anushka.
So not necessarily. Again, Emma can come in as well. So there, I'll hand over. There are opportunities to go outside of the UK, and more of these are being set up and established. So no, they're not always. Don't always have to be in the UK, and particularly if a student has a particular wish to go to a certain country or has their own connections as well, then that could be worked on. But Emma, I'll let you say more as well.
I just totally agree with you. It could be anywhere. And for example, drug development happens worldwide, and so it'd be great to go and do a professional year in another country, and nothing would stop you doing that, apart from you have to get one.
Great, thanks. So just having a look at the other questions. So someone's asked about placement years in clinical pharmacology. Emma, do you want to talk about placement for that?
Thank you for your question. The idea is that there's you get to the end of year 2, then you take time out of the degree and go and spend a year working. The sorts of opportunities that you might have might be to go and work for a big pharmaceutical company. So, for example, working in a project management role, or perhaps in a laboratory, or perhaps in a clinical trials unit, learning how to run a clinical trial. The idea would be that you go and do something relevant to your degree, ideally, although again, it doesn't have to be that. I guess it's learning any generic skills for the workplace, like team working and presentation skills and writing. So the idea is you go and do something in some way relevant to your degree that will teach you work skills, maybe boost your finances, increase your employment prospects, and also helps you come back fresh and ready for the third year. And as Kate says, you end up with a better degree. It's a really good idea to be work ready at the end of your degree. It makes you competitive, and I think the opportunities in pharmacology are enormous.
Great. I think we have time for maybe one more question. So for clinical pharmacology, are there optional modules that bring in other science subjects, so maybe around psychopharmacology, neuropharmacology?
We do study. I mean, we do study psychopharmacology and neuropharmacology as a standard module on the whole course. So that's in year 2. So yes, you would study that. You have 2 research projects where you could choose to do them on those topics. And in 3rd year, we do hot topics and we have optional 15 credit modules. We don't specifically have one on psychopharmacology, but pretty much all the pharmacologists, a lot of pharmacologists at St George's are interested in neuropharmacology. So if that was your interest, you could definitely develop that. And as I said, we want students who are curious and interested. So if you like that, we would encourage and support you in developing your interest.
Sounds very exciting.
Great, thank you. I think we're almost out of time, so we'll have to stop the questions now. But if you have asked a question and we haven't been able to answer it, do rest assured that we'll get back to you after the event. And I just want to really quickly flag something up. So Emma mentioned UniBuddy before. So on the St George's website, we do have ambassadors there that you can chat to, ask questions to. And we know it's so important at this point when you can't come in to an open day and talk to our current students. So do go onto our website. You'll see student profiles, and we have people who are currently studying the biomed, the biomed, Sci and clinical pharmacology, so do come and chat to them about their experiences. And I'll pass back to Jenny now.
Thank you, Fiona, and thank you to our 2 panelists, Dr. Everett and Professor Baker. Thank you so much for your insight into the programs. I know I've enjoyed it, and I hope it's been really useful to our guests. And thank you to all of you who've sent in your questions. If we weren't able to answer your questions today, we will be following up with answering the questions. Our email is, as you can see on the presentation, webinars@St George's, so do feel free to send a question there. You can also contact us via Facebook, Twitter and Instagram, and we'll be following up this webinar today with a summary sheet. And if you have also, I'd encourage you to have a look on our Explore St George's webpage, where we've got lots of really useful information for anyone looking to apply to St George's. And that leaves me to then just say thank you, a big thank you to everyone involved today. Thank you so much for your time. And I hope that you've enjoyed this webinar, and that we look forward to possibly seeing you all again in the future for our other webinars and any events that we'll be running. So just want to say thank you to everyone, and take care. Goodbye.
And good luck.
Thank you. Good luck. Yeah. Bye-bye.
Bye.
Take care. Bye-bye, everyone.